Hello everyone, welcome back to Neurospicy Nursing. This is gonna be my second or third time recording this. The other ones either like had no sound or like the file corrupted somehow. So hopefully this one actually makes it out to you guys. But this is just a quick quiz. There's 30 questions. If you haven't done it already, I'll just tell you guys pause it and then I'll go into the rationale. Right. So here's the first one. If you haven't done it, go ahead and pause it. The correct answer for this one is going to be B. So normal kick counts is supposed to be 10 movements in 1 to 2 hours. So you're in a 1 to 2 hour period, they should have about 10 kick counts, fetal movements that they should be able to count. All right. If you haven't done it, go ahead and pause. The correct answer to this one is B. Any abdominal ultrasound requires a full bladder because it's going to be able to push the uterus upwards for better visualization. And the correct answer to this one is C. Severe pain is going to be a complication of a transvaginal ultrasound. All right, pause here. The correct answer is B. If you have a score of less than or equal to 6, there's a risk for fetal asphyxia. All right. For this one, the correct answer is B, pretty self-explanatory. There just is not enough amniotic fluid in order to do the amniocentesis. All right, the correct answer for this one is C, a fever that's greater than 100.4, you're worried about infection. So if they have the amniocentesis, if they have a fever that's greater than 100.4, they should be seeing, really going to the ER or seeing their OBGYN. All right, the correct answer to this one is going to be C. Sensitize, which means that there is no ROGAM necessary. All right, the correct answer for this one is B. If you have a low AFP, your child should have Down syndrome or will have Down syndrome. All right, this one, B, which would make the strip blue, which means alkaline, means that there is the presence of amniotic fluid. All right, number 10. So we're a third of the way there. I know we're going through this pretty quickly. Um, just bear with me. I will maybe be a little frustrated because I've recorded this so many times. I just want to get this out to you guys. All right, 10. The correct answer for this one is B. So a positive FFN means that there's a high risk for preterm labor. FFN is the fetal fibronectin test, by the way. All right, 11. So the correct answer for this one is going to be B. If there is late decels with greater than or equal to 50% of the contractions, it's positive, a positive CST. All right, 12. The correct answer for this one is C, a score of 6. So remember, a really good APGAR is 8 or greater. All right. For sorry, yes, we're on 13. For 13, C, a positive pregnancy test is a probable sign of pregnancy. So if you don't understand why this is, make sure that you watch my previous lecture. But basically, a positive pregnancy test doesn't necessarily mean that you are pregnant because there are other things or other conditions that you can have that can cause that positive pregnancy test that obviously isn't if you're pregnant, right? All right. So 14, the correct answer for this one is C. Fetal heart rate or visually seeing the fetus on an ultrasound is one of two. I think there's like three positive signs of pregnancy. Those are like the only signs of pregnancy, positive signs of pregnancy. Again, if this is confusing to you, watch my previous lecture. I go a lot more in depth to that. All right, 15. The correct answer for this one is B, vasoconstriction. It's going to reduce the fetal perfusion. All right, 16. The correct answer for this one is B, anytime there's active um, HSV, it's always going to be a C-section. All right, for this one, the correct answer for this one is B, toxoplasmosis. This one isn't out in a lecture yet, but in my next lecture, I'm going to go pretty in depth with all of the torch infections and stuff like that. So make sure that you guys watch that. We're also going to go through the complications and stuff like that for pregnancy. Okay, 18. CMV transmitted via breast milk. So the correct answer for this one is B. CMV is transmitted via breast milk. Okay. 19. If there's a positive direct Combs test, then it will be A, that there's antibodies on the fetus's RBCs. Okay, and 20. The correct answer here is B. We're going to delay ART until after 14 weeks if they are newly diagnosed. After 14 weeks, then that risk for a medication being like teratogenic is going to decrease a lot. So we just wait till after the 14 weeks if they have a new diagnosis of HIV. All right, 21. The correct answer for this one is going to be B. The LS less than 1.5 means that there's a pretty severe risk for respiratory distress. We want this ratio to be greater than 1.5. 2 is more preferable. All right, the correct answer for this one is going to be a respiratory rate less than 12. Magnesium, kind of think of it like opioids, decreased CTRs, decreased respiration rate, um, decreased level of consciousness, all of that you're going to see with magnesium. Okay, 23. The correct answer here is B. So because of the decrease in platelets, they end up with something called DIC. DIC can also be seen in septic shock. I'm gonna put a full lecture on DIC in itself because it's a little bit more complicated to just throw in with everything else. So look out for that. All right, 24. The correct answer here is B. So again, like how I mentioned previously, MAG depresses not just mom's respiratory drive, but also can depress baby's respiratory drive. Okay, so the correct answer to this one is going to be B. The fern pattern that you see is indicative of amniotic fluid. All right, and the correct answer to this one is going to be C, amenorrhea, which is a presumptive sign of pregnancy. The correct answer to this one is going to be C. When looking at the FV, or the amniotic fluid volume. It helps also assess the chronic oxygenation of the fetus. So we have to make sure that we are really assessing that amniotic fluid volume. All right, 28. The correct answer is B. If you have a short cervix, it puts you at risk for preterm labor. There are um, quote unquote treatment options for that we're going to go over in the next lecture video, so look out for that, but it is a risk for preterm labor. All right, the correct answer for this one is going to be A, correct interpretation of this GTPAL. So they have had 4 gestations, 1 term pregnancy, 1 preterm pregnancy, 1 abortion slash miscarriage, and they currently have 2 living children. And the last question here, the correct answer for this one is A, CMV is transmitted through breast milk. And that's all I have for you guys today. Make sure that you're looking for these next videos. I'm changing up how I do some of my content a little bit, just because I'm not super pro using that AI voice anymore. I really want to try to use my voice for these lectures, even though I know I kind of drone on and on and go off topic a little bit, but if you could look out for those. And yeah, that's all I have for you guys. Thanks for being here. See you in the next one. Bye.